I don't believe gynecomastia to be a cosmetic surgery procedure. It's more of a reconstructive procedure, at least in my eyes. Gynecomastia is a unique mixture of cosmetic and reconstructive surgery. And I'm in a unique position where I treat a lot of gynecomastia, and it exposes me to an amazing amount of stories of how teenagers feel as they go through this, and it really can be quite devastating to the patients and the teenagers and the parents. I routinely will hear stories about how teenagers are unable to take their shirt off in public. Here we live in sunny Southern California, and they can't even take their shirt off at the beach.
Well, I had a little bit of excess on my chest. My nipples were kind of protruding. There was some extra tissue back there, and it had caused me large amounts of discomfort. I mean, I'd been kind of a jacket guy for 6, 7, 8 years, and I didn't really feel confident whatsoever. It affected my posture even, and I didn't want to continue with that. I just wanted to change that.
Gynecomastia surgery is a very specific surgery, and plastic surgeons either do it or they don't do it. And it puts me in a unique role where I do over 100 of these surgeries a year. And there's about 10 plastic surgeons in the country that do over 100, and it allows you to focus on the patients, treating them both surgically and emotionally.
When I was first considering this, I didn't really feel comfortable talking about it with my dad. I thought, well, here's his son having a procedure done that's very feminine in nature, but really you just have to look past it, and it is, even for, it's a minor procedure, plastic surgery procedure, but it's still a big procedure as far as how you take it. It took me a long time it took me several months to just get used to the fact that I could now walk a lot more confidently. But it was a big, for me, even though it wasn't physically a big procedure, it was mentally a big procedure. Well, this procedure motivated me to change my life, and it motivated me to go in the right direction. And so I've been able to change my look substantially. I was pre-op 292, and now I'm down to about 210. So it set me in the right direction completely. It was just,
You've taken it to that next level. I mean, I took away the stuff that you could not have gotten rid of because it would have persisted, but I mean, you've done 90% of the work. Real. Congratulations. I'm serious, man.
No.
I routinely get the question, should a patient take care of it early in life or later? And that depends on how much it bothers the patient. But in Luke's situation, he developed it early on. And he developed these characteristics where he would hunch his shoulders forward, and it actually changed his personality. And he's even told me that it's taken about 9 months for him to start putting his shoulders back and gaining that self-confidence. So in that regard, it's best to do it early on.
Confident. I have just much more confident, and I have a lot more, I feel, going for me. It's a lot about perception. I may have had a lot going for me before, but I definitely feel like I have now, my attitude is completely different, and I feel a lot more confident with my interactions with people of the opposite sex even. Just women and myself were not, it just didn't feel like a match made before this procedure, before I changed everything. Now, completely different. It was well worth it, and I'm really happy I did it.
You know, society really doesn't understand how much embarrassment these patients have. And it's not just the patient, often the parents will feel that too. They see their child removing themselves from society, and they don't know how to react. They don't know what to do. To talk to your child, to see if your child is wearing a shirt all the time, and ask him if he's self-conscious about his chest. And if he is, at least let them know there's a way out. We've had it several times where the parent after the surgery, the child has just changed tremendously. And the parents literally have told me, thank you for giving my child back.